warm welcome to this launch event of the study, COVID-19 and Violence Against Women, the Evidence Behind the Talk. Today's event will bring together data scientists, policymakers, and CSOs to discuss the importance of using non-conventional data sources for gathering information during crises. And we will share findings related to a particular study about violence against women during the COVID-19 lockdowns. My name is Sarah Nibs. I'm the Deputy Regional Director of the UN Women Regional Office for Asia and the Pacific, and I will be moderating today's session. The regional study that we will launch today, conducted by Quilt AI for UN Women and UNFPA, and partially supported by the UN Women ILO Safe and Fair programme, part of the global EU-UN Spotlight Initiative to End Violence Against Women, presents insights on 8 Asian countries in this context. These are Bangladesh, India, Indonesia, Malaysia, Nepal, the Philippines, Singapore, and Thailand. Before we start, I want to acknowledge that during the session, we'll be sharing content related to violence and abuse that was shared online. We acknowledge that this may be triggering or upsetting. We will share a link in the chat box of helplines across Asia and the Pacific, and we encourage anyone who feels they would like support to seek it. Now I'd like to share a couple of housekeeping items. This event is scheduled until 11 a.m. Bangkok time. We kindly request you to mute your microphone throughout the session. You're welcome to use the chat box for comments and questions, and we will have times for Q&A with the audience after the discussion. So we look forward very much to hear your contributions then. Before we turn to our distinguished guest speakers, I'm delighted to welcome for our opening remarks, Mr. Mohammed Nasiri, the Regional Director of UN Women for Asia and the Pacific, and Mr. Björn Andersson, Regional Director of UNFPA Regional Office for Asia and the Pacific. Mohammed, the floor is yours.
A very good morning to all who have decided to be with us here today, and I'm very grateful that you did. I know it's a busy week for the feminist community and the feminist movement, and I really appreciate that you are with us here today. I would also like to thank Bjorn and our sister agency UNFPA for this partnership, and of course Quilt AI for their expertise. Throughout this event, we will discuss the findings from our latest data study, COVID-19 and Violence Against Women, the evidence behind the talk. This important analysis sheds light on how COVID might be contributing to the incidence of violence against women and girls in Asia and related services and the service provision. COVID has caused stress, disruption of social fabrics, and loss of income that has exacerbated risks of violence against women and girls. The estimates available before the COVID pandemic showed that 1 in 3 women worldwide have experienced physical and/or sexual violence by an intimate partner or sexual violence by any perpetrator in their lifetime. There have been numerous reports about sharp increases in reports of violence against women since the onset of the pandemic, which caused alarm. In April 2020, the United Nations Secretary General urged all governments to make the prevention and redress of violence against women and girls a key part of their national response plans for COVID. The appeal was answered in less than 24 hours in a statement by 146 member states and observers that expressed strong support. Data regarding violence against women during COVID has been limited, aside from data from service providers, which tells just part of the story. Since it's risky to survey women who may be facing violence at home, we turn to another data source, big data available through social media use. Seeing the magnitude of violence that was being reported, we sought to understand the experiences of women related to violence during COVID and how accessible the existing services are for those seeking help. This study allows us to join these dots. By looking at online searches and social media posts, it gives an indication of what are the types of violence against women and girls related issues that women are searching for, and how all support agencies government, private sector, international organizations, and civil society can shape and improve the ways they connect with survivors. We are already a year into the COVID pandemic, and by now we have seen that online reach is a priority for improving the services and information about violence against women that was available before the pandemic. This highlights the need to close the digital divide, which makes it impossible for some women to use digital or phone-based support services. Service providers, including government services, should ensure that victims continue to have protection and support when they are in danger or crisis. Strengthening helplines, online counseling, and technology-based solutions, such as text or chat support services, has been a lifeline in many places. There is clearly a need for swifter action along with comprehensive and good quality health, social, legal, and justice services and legislative frameworks that work to protect survivors. The findings from this study are also a reflection of existing inequalities that have taken a turn for worse for vulnerable groups. For instance, the report reveals that almost 80% of searches in migrant-dense neighborhoods in 3 destination countries, Malaysia, Singapore, and Thailand, are related to mental health, highlighting an increase in feelings of stress, depression, fear, anxiety, and loneliness amongst migrant populations. With more data, there is an increasing understanding about the nature and extent of violence against women. But we still need to invest further in testing what works to reduce and prevent violence from happening in the first instance. In particular, the focus must remain on prevention of violence against women through laws, policies, and systems, reducing poverty at the community and individual level, making environments safer, such as public spaces, schools, and workplaces, preventing childhood and adolescent abuse, and critically transforming attitudes and social norms towards gender equality. We will hear about some of these solutions in today's session. I'm looking forward to hearing the insights from civil society members with us today regarding how these findings may be useful in reaching those that are hard to reach in times like the current pandemic. I would like to extend my appreciation to the EU for partially supporting the study through the Safe and Fair program, a joint program with ILO, UN Women, and UNODC, part of the global EU-UN Spotlight initiative to eliminate all forms of violence against women and girls. We are hopeful that the findings from this study will help us all, government agencies, civil society organizations, and the international community in shaping responses to survivors of violence in all solutions. Thank you again for being with us today and joining us on this journey of learning. Back to you, Sarah.
Thank you so much, Mohammed, for your remarks. And I would now like to invite Mr. Bjorn Andersson to give his remarks, please. Bjorn, over to you. Bjorn, I think you might be on mute.
You're absolutely right, Sarah. Thank you for that. So good morning, everyone. And let me also firstly join Mohammed in thanking all our partners for making this report possible, because it's really a groundbreaking data that is being presented. I'm also pleased to join other sister agencies, of course, UN Women and the ILO, in launching this important and in many ways, like I said, groundbreaking report. A year ago, as the COVID-19 pandemic began to engulf the world, we at the United Nations Population Fund were the first to warn of dangerous consequences for the health, human rights, and well-being of women and girls. Among the most concerning predictions, a sharp escalation in the incidence of gender-based violence and harmful practices, including child marriage and female genital mutilation. Our forecasts have unfortunately come true in the Asia-Pacific region and globally, as pandemic-related lockdowns have meant women have often been trapped indoors and with their abusers. UNFPA and partners have been working to ensure that vulnerable women and survivors have access to information and services that respond to the crisis. Through one-stop crisis centers in countries like Mongolia, through mobile technology like phone applications, and in Pakistan's Punjab province, or through women-friendly spaces in humanitarian settings like Cox's Bazar in Bangladesh. We know there is no substitute for comprehensive prevalence surveys on violence against women, like those conducted under our NOVA data initiative in Asia Pacific, to gather robust data with well-trained enumerators conducting interviews in a safe, respectful, and confidential environment. But obviously, population-based surveys are next to impossible to conduct while prioritizing women's safety amid pandemic restrictions. Which is why approaches like big data analysis are so useful, particularly at this time, as the findings from the 8 countries featured in the study point to the challenge millions of women are facing. The analysis also shine a powerful light on the social norms and realities that women have to deal with, the patriarchy, conservatism, and chauvinism that undermine gender equality and women's empowerment in country after country, society after society. When women under attack have tried to reach out for help online or have tried to preemptively take action to protect themselves, they have often met with messages like, "Don't provoke your husband during lockdown." Messages that place the onus and the blame on women, rather than on the men who perpetrate violence in the first place. Indeed, besides the analysis that helped map out the escalation of violence against women in the 8 countries surveyed, this report also plays a hugely useful role in illustrating the misogyny that pervades all societies in both so-called developed and developing countries alike. The manifestations may seem different on the surface, but at the root they have gender inequality and equality in common. It's abundantly clear that in our interconnected world, digital platforms can play a crucial role in helping address violence against women in different ways. But it's also clear, both from this report and other studies done in other contexts, that there is an urgent need to provide digital literacy skills to disadvantaged populations to ensure access to potentially life-saving online tools, both in the context of COVID-19 and well beyond. Supporting women and girls impacted by the digital divide, including those in migrant communities, ethnic minority populations, and those of diverse sexual orientations and gender identities, must be a priority for governments and partners as countries seek to build back better in a post-pandemic world. The report launched today is both a cry for help and a call to action. Our collective response will constitute an important pillar of efforts to strengthen gender equality and the health and well-being of women and girls, contributing to help ensure that the vision of the SDGs, no one is left behind. And with that, colleagues and friends and participants, I am really looking forward to listening to the outcome of this meeting, because this debate and this launch is helping us to move forward together. Thank you.
Thank you so much, Mohammed and Bjorn, for your very powerful remarks and for really setting the scene for the research that we're going to look at today. Now I would like to introduce our panelists, our partners and guest speakers today. So first of all, I would like to welcome Ms. Pia Balas, Ms. Pia Balas from Quilt AI, who will present the study's findings. Following on from the presentation of findings, we will be having a moderated discussion, and we will be joined by 3 additional expert panelists for that. First of all, we will have Ms. Uma Shah, who's the chairperson of Sati in Nepal. Secondly, we will have Ms. Shaili Hingorani, who is the head of advocacy and research at AWARE Singapore. And thirdly, we will be joined by Ms. Sumitra Viswanathan from Women's Aid Organization Malaysia. So I'm really looking forward to hearing from all 3 of our panelists. But initially, we're going to hear from Pia from Quilt AI, who will present the study and findings. Pia, I would like to hand over to you, and I understand you will be sharing your screen with us. Over to you, Pia.
Great, Sarah. Thank you so much for that kind introduction. Everyone, just give me 2 seconds as I share my screen. So first of all, I would just like to say a huge thank you to UN Women, UN Women Count, to the Safe and Fair program, and to UNFPA to giving us this opportunity to use innovative data collection tools to really understand what are the perceptions and concerns around violence against women and girls during this time. I think, as both Mohammed and Bjorn put it so eloquently, at a time when it is difficult to have face-to-face communication and data collection such as surveys, both digital research and artificial intelligence tools are a powerful alternative for us to better understand what are the actual needs of women and girls during a time of crisis, and how can both service providers and policymakers address these needs in a better way whilst using online engagement. So just to give a quick background to the study, as already mentioned, the aim of the study was really to try and understand, pre and post-COVID, what are the perceptions and also the concerns around violence against women and girls across 8 countries. What we tried to do is first understand what the actual online discourse is across different social media platforms in these 8 countries. So this included looking at posts on Facebook, on Instagram, on Twitter, on YouTube, and looking at TikTok as well, depending on the country context. So this is what people publicly state online on social media regarding this actual topic. Secondly, we really tried to look at what is people's search behavior. So what is the real information that they're looking for when we talk about the issue of violence against women and girls. Third, we used our innovative artificial intelligence tools to try and better understand the level of online engagement that service providers have. And I'll get into a second to explain what that actually was. And finally, we tried to understand whether both social media discourse and search behavior is giving us an insight into whether vulnerable groups such as male and female migrants have been differentially impacted in any way during the pandemic. This study had 2 phases to it. So in the first phase, we were really just trying to understand the landscape of what is the social media discourse and search behavior on violence against women and girls. And it was in the following countries. For South Asia, as already mentioned, it was in Bangladesh, India, and Nepal. And for Southeast Asia, we focused on Indonesia, Malaysia, the Philippines, Singapore, and Thailand. The time period that we covered was between October 2019 to September 2020. In terms of deciding when the actual lockdown period was for each country, we looked at a Google mobility report, which told us when mobility in each country was at its lowest point. And that then told us which month we used as official lockdown. In terms of the search behavior that we collected, we curated a list of 3,502 words on violence against women and girls. Specifically, we looked at search keywords that were under physical violence, sexual violence, and emotional violence. We also looked at search words that we assume have been typed in either by survivors themselves or someone who knows a survivor. And finally, we looked at specific search terms that are connected to help seeking. Across the 8 countries, we looked at over 20 million searches. In terms of the social media posts that we analyzed, it was a total of 2,000 for this first phase of the study. Then in order to think of our hypothesis, which was trying to ascertain whether misogyny grew during the pandemic and whether online support grew as well, we also conducted an in-depth hashtag analysis. In this, we looked at over 250 hashtags. About half of them were representing misogynistic hashtags, and half of them were looking at online support. With these, we looked at how these either grew or decreased during the pandemic. And in total, we analyzed over 300,000 tweets across these 8 countries. Finally, for the service provider analysis, we were given a list of 32 service providers in the region. What we did is we looked at all their social media handles. We downloaded 7,000 plus images and 10,000 plus tweets to try and better understand whether these service providers were in terms of online engaging, actually reaching survivors in terms of the demands that they were showing across social media and also search behavior. The second phase of the study was really trying to focus on vulnerable groups and in particular male and female migrants. Here we looked at 3,600 social media posts. This also included data that emerged for other vulnerable groups such as the transgender community and also other types of migrant workers. We also looked at 111 public discussion groups across Facebook and Reddit to try and better understand the challenges that male and female migrants were having during COVID. And finally, to understand what are male and female migrants possibly searching for, we did a so-called Dragnet analysis, where we isolated 3 migrant-dense neighborhoods, one in Singapore, one in Thailand, and one in Malaysia. We then bid on keywords that were related to different topics and challenges that we had seen coming up in the social media discourse. And then for 3 days, we studied what presuming male and female migrants were actually searching for in those neighborhoods to try and better understand what their challenges are during this time. I'm now going to run you through the actual findings. I will first go over the search findings. Second, I will show you what we found on social media. Third, I will present to you what we saw in the hashtag analysis, then the focus on vulnerable groups, and finally finishing off with what we found in our service provider analysis. For our search findings, what we found for all 8 countries is that searches related to physical, sexual, and emotional violence all increased after lockdown actually occurred. We particularly found that searches that were related to physical violence, so domestic violence or intimate partner violence, are the ones that particularly went up across all 8 countries. Secondly, we found that for almost all countries except 2, also the searches on help seeking increased. So individuals asking about hotlines, asking about how to actually report a case increased in all countries. We see in Malaysia, for example, that it has increased by 70%. We see in Singapore that it has increased by 29%. So not only did searches go up for informational searches on physical, sexual, and emotional abuse, but also the help-seeking searches increased. This is to give you a glimpse of how we did a deep dive on the specific types of violence for each country. So here you're seeing a glimpse of how we looked at emotional violence in Indonesia. And the graph shows you how it's increasing after lockdown, which is the second lowest point of mobility. In terms of general information searches, we see that those actually increased by 13%. And some of these include financial abuse, emotional abuse signs. Secondly, we see that survivor/victim searches went up by 31% as well. And some of the specific search key terms that we found here were how to stop controlling husband, husband controls my money, boyfriend insults me. So again, this went up by 31%. And finally, we find that help-seeking searches for emotional violence went up by 400%. So these are specific keywords like report emotional abuse, report mental abuse. These keywords increased by 400%. Then for sexual violence in the Malaysia context, we found again that post-lockdown general information searches actually increased by 28%. And so some of the keywords here were rape, types of sexual harassment, and signs of a sexual abuser. For survivor/victim searches, we found that it increased by 21%. And it was keywords like I got raped and was I molested as a child. And finally, help-seeking searches increased by 15%, where again, people are asking for sexually abused help or report sexual harassment. Finally, we also did a search analysis on which keywords are emerging versus dominant. So emerging keywords are those that have low volume but a high rate of change. This shows that people are increasingly interested in actually searching for this information. And dominant search words are those that have high volume and high rate of change. So if we just look at some of the country examples here, in Bangladesh, for example, some of the keywords that were emerging post-lockdown were, experiencing verbal abuse from partner, abusive signs, or report domestic violence and abuse. Some of the dominant search words that we find here is, abusive husband/partner or violent husband/partner. If we look at the Philippines over here, we find that some of the emerging keywords are sexual harassment, domestic violence helpline, and women's helpline. Some of the dominant search keywords that we find here are, again, violent husband and partner or abusive relationship and behavior. I will now be moving on to the social media findings that we found across all 8 countries. So with the 2,000 social media posts that we analyzed, these are the different topics that emerged. But among them, there are really 2 that stand out. The first is that we found amongst these social media posts that there was quite a bit of discourse around misogyny, victim blaming, and misconceptions around violence against women and girls. Secondly, the other dominant topic that really rose out from these social media posts was community and online support during the pandemic. That was trying to fight back some of the increase in misogynistic posts that we saw. Other ones are more country specific. So when we look at religion, tradition, and caste, we find that in India, Bangladesh, Nepal, and Malaysia, we see a higher percentage of such discourse. When it comes to justice, law, and regulations, and this is specifically referring to mistrust in the justice system and being very frustrated at it, we find that in Thailand, Indonesia, and Philippines, there's especially a high level of frustration of the justice system not doing what it is meant to do for survivors. And then if we look at NGO support, we find that in the Philippines, there's a higher number of discourse there. And finally, if we look at how violence against women and girls has been mainstreamed in social media and entertainment, we find that there is a higher discourse in the Thailand context than for other countries. Here are just some powerful examples of what we saw in the social media posts. So in terms of increased misogyny and victim blaming, we found in the Indonesia context a post that said sexual violence occurs because the perpetrator is influenced by alcohol. So again, misconceptions around what are actually the root causes of violence against women and girls. At the same time, we saw people actually challenging misogyny and fighting back. So in Nepal, one of the posts that emerged is it should come as no surprise that women and girls in Nepal face so much violence when the state itself treats us like second-class citizens. Women don't want platitudes. Women want equality, citizenship, gender equity. We also saw that there was a lot of frustration in terms of government support and not actually responding to the needs of survivors. So in the India context, a lot of people were worried about the reopening of liquor shops and how that's going to put more women and girls at risk of increased violence at home. We also saw that there was a lot more outpouring of online support during the pandemic across most countries. So this was, again, either people speaking up for survivors or trying to fight back on the misconceptions that already exist. So in Bangladesh, we see a very telling quote, which says, I'm so sick of people downplaying the act of non-consensual touching as sexual assault. Quote, it was just a touch, smack, grope, end quote. Consent still wasn't given, right? They still said they were uncomfortable, right? And then we see some discussion around the mainstreaming of sexual violence in entertainment. And finally, in the Indonesia and Philippines context, we saw a lot around legislative advocacy. So in Indonesia, there was discourse around the sexual eradication bill and how it has been stalled during the pandemic. And in the Philippines, it was around the SOGI bill. Finally, as there was frustration sometimes with government response, there was also frustration with the police and the justice system. And we saw this especially coming out in Singapore, Indonesia, and the Philippines. In the Philippines, it was the most direct when you look at the social media posts. So just to give one example, a teen who filed a molestation complaint against 2 cops in the Philippines was shot and killed, returning home from the station where she filed a complaint. She requested a police escort when she noticed she was being observed. None was provided. So these are some powerful stories and expressions coming out on the different social media posts that we're observing. At the same time, people also sought help on social media. So just like we saw help-seeking searches increase in people's search behavior across most of the countries, we also saw some powerful examples on social media where people were directly asking for help. So in Bangladesh, there were different Zoom meetings that were held to try and give women and girls more self-defense tips. In the Malaysia context, we saw that there were a couple of different online education initiatives to make people much more aware around violence against women and girls. In India, we saw a lot of frustration in terms of that no one helps, but at the same time, we see some middle ground social media posts like the second one, where someone is saying no one will help. They just convince women to go away. If you're really hurt, go to an NGO. So at least giving an alternative source of service provision that a survivor can go to. Finally, we also did a platform analysis for each country where we basically said, okay, what type of discourse is going on in each country, who is actually talking about these issues, and is it in an urban or rural context, and what is the age group of these individuals? So this is just an example from the Indonesia country study. So we find that on Facebook, there was discourse on the misconceptions against violence against women and girls. And there was also a fair amount of discourse on migrant and vulnerable groups and how they might be impacted by the pandemic. For the misconceptions, we found that it was largely a male skew in the 18 to 34-year-old age group. For the migrant and vulnerable discourse, we found that it was half of a male skew and in an older segment. For Instagram, we found that there was much more discourse on awareness around sexual violence and frustration towards the government. And here we saw that it was happening in urban areas with a largely female population that was in the 18 to 34-year-old age group. We did the same also for Twitter and for TikTok. Then, as I mentioned earlier, we found an increase in misogyny online, but we also found an increase in online support. And we wanted to further strengthen this finding with doing an in-depth hashtag analysis. So what we did is we came up with over 250 different hashtags, and half of them were misogynistic and half of them represented online support. We looked at 300,000 plus different tweets, and then we saw where did these increase during the pandemic. And so we found, for example, in terms of misogynistic tweets that were either emerging or dominant, we found that femtwit in Thailand, for example, really increased a lot. We also found that International Men's Day increased a fair amount in Malaysia. We found that gender-biased laws had an increase as well, as did the Men's Commission in the Indian context. Here you see some examples of hashtags that symbolize online support and how those also increased during the pandemic. So we see that Stop Rape in Bangladesh really increased, and violence against women in Malaysia. You see Don't Tell Me How to Dress increased as well. And then on the right-hand side, you'll see those that have higher tweets and postings that have also increased. What's interesting is that there were certain hashtags that did not exist before the pandemic that came up only during COVID-19. So two of them were in the Bangladesh context. One was Stop Rape Culture Bangladesh, and We Want Rape-Free Bangladesh. We also found that a new hashtag on the SOGI bill appeared in the Philippines context. Moving on to how vulnerable groups have been differentially affected by the pandemic, and what do we see again in the social media discourse and in the search behavior. One of the main things that we saw coming through both the discussion groups and the 3,600 social media posts that we studied were the challenges to actually return home. So some of the more powerful examples of this were in the Philippines context and also for Nepalese migrants. In this, we also see how mental health and depression comes through as a key factor that many migrants were affected by during this time. I'm just going to go over one post that's by a male Nepali migrant who says, he's based in Abu Dhabi during the lockdown, and he's saying, what to do? My life is spent locked in a room. I want to see my family. At least when I had work, my mind was busy. But now there's no work, nor no money. Even to eat, there is no food. My dreams are shattered. Here, I don't even get to meet anyone. My only friend is my bed. If I die, it would be much better to die on my own soil. Where did this life take me? Secondly, we also tried to look at how are male and female migrants represented differently in the online discourse and also in search behavior. In the online discourse, we found that when it came to female migrants, they were either invisible from the discourse or they had to face slanderous and misogynistic remarks. So both in the Nepal and Indonesia context, we often find that they're being stereotyped as female migrants who are simply going abroad to have affairs with men from India or Bangladesh or Pakistan, and that's the only reason that they have to go abroad for work. We also found a fair amount of discourse on other vulnerable groups. So in the India context, what was interesting was that it was very much so around transgender groups and some of the challenges that they were facing during lockdown. On the left, you see an interesting post where someone has actually built a safe quarantine network specifically for transgender individuals. We also saw examples of some transgender influencers on YouTube who tried to have different sessions to answer questions of how people could be safer during the pandemic. On the Thai-Burma border, we found some interesting Facebook groups where Burmese migrants are able to receive information on when it's actually safe to cross the borders and get regular updates on other issues that are relevant to them as well. And in the Singapore context, we found that there was many individuals from the LGBTQI+ community that were having challenges in actually finding safe shelter during the pandemic. And so some of that online support towards them came out in the form of organizations trying to offer such safe shelter or individuals trying to speak out on their behalf. We also saw general online support that came out in the other countries. So in India, there were a couple of interesting Instagram carousel posts that we found that talked about the emphasis on intersectionality and making sure that that's considered during the pandemic. In Bangladesh, we found some support for Rohingya refugees. And in Malaysia and Indonesia, there was sort of more general support towards migrant workers there and helping them with issues such as taking the legal route to employment abroad or just speaking out against people's everyday stereotypes. So this is showing you the Dragnet results where we really tried to understand what are migrant men and women searching for in migrant dense neighborhoods in Malaysia, Singapore, and Thailand. I'm actually just going to show you the last graph, which gives you a summary of what we found. So amongst the searches, we found that 78% of them for all three countries combined were actually on mental health issues and depression being faced by male and female migrants during the time this Dragnet was run. Secondly, we found that there were searches around violence, so about 17%. And most of these were either on domestic violence and physical abuse, followed by sexual violence and help-seeking searches. And finally, 5% of the searches that we picked up during the Dragnet were actually directly related to employment issues. So either problems at work that these individuals were facing or trying to seek new employment because they had lost their livelihoods, presumably during the pandemic. So we also tried to look at what are some coping mechanisms for vulnerable groups, and we found some interesting patterns here. For women and girls in the Indonesian urban context who have been direct victims/survivors, we found so-called confession accounts online where people could actually talk about the experience that they had gone through and then directly be connected to service providers and others who can help them out. We did not find this type of confession account in any other country. Secondly, in the India and Singapore context, we found a big push by civil society actors to really try and engage with women and girls who are going through such violence and providing them services online with high online engagement. And then in Bangladesh and Nepal, we found a call for different online petitions and calls to action. So in the Bangladesh context, this was again for Rohingya refugees specifically. And in the Nepal context, there was a lot of discourse around sexual violence that's experienced by Dalit women and girls. And we saw a couple examples of calls to action that were being really spread there. We also found in the Indonesia context, again, which we did not find in other countries, was that there was a fair amount of discussion groups that were targeted specifically at male and female migrants. We also found some migrant YouTube influencers who were giving very valuable and important advice from, how to go abroad as a migrant worker, what happens in different country contexts, and being a source of support. So it would be very interesting to try and look at these types of discussion groups and YouTube influencers and how these can be leveraged as a form of online engagement to really reach vulnerable groups in a better way. Finally, I just wanted to talk to you about our service provider analysis that we did. So again, we had a list of 32 different service providers, and we downloaded 7,000 images and 10,000 plus tweets from their social media handles. We did an actual score analysis where we looked at their Facebook followers, we looked at their Facebook likes, we looked at the number of tweets that they post, the tweets that are shared and also reshared. And based on this online engagement score, we were able to see whether it's an organization that is engaging in a high way online or is more of a low engaging service provider. So this is in no way meant to be a reflection on the on-ground service delivery that any of these service providers do, which is absolutely incredible and admirable for all of them. But this is very much so just looking at what is the actual online engagement and what was the potential online reach to survivors and victims during the pandemic. What we did with the 7,000 images and 10,000 tweets is that we put them through our proprietary machine learning analysis tool, which not only detects what types of objects are in an image and what type of text is used in a tweet, but it also detects what is the emotion that is being shown in the image, or what is the emotion that we can detect in the type of text that is in the tweet that is going through the machine. So we found something interesting. We found that high engaging service providers, they share information much more visually and much more directly in terms of their resource information. Secondly, the types of emotions that were detected by the machine were very positive. They were related to community and affiliation and happiness and creativity. What we found for low engaging service providers is that they often shared images of trainings and behind the scenes work rather than directly providing information on the resources that they actually give and how survivors can directly attain help online. Secondly, we found that some of the images and text that was shared by low engaging service providers symbolized solitude, fear, and to a certain extent was too indirect in the way that communication was actually shared. So some of the tips and tricks that we have really come up with for service providers to try and strengthen their online engagement and reach individuals in a better way for high engaging service providers, which is already existing and something that can be strengthened, is trying to bid on specific keywords so that individuals find out about you immediately. So one of the service providers that we studied actually has a partnership with Google, and when you type in domestic violence, you are immediately led to their website and to the resources that they offer. So that is one very good way of trying to be better with online engagement. Secondly, having options in different languages and the ability to filter by location and other domains is super important as well. We found for some service providers that information was only given in English. Secondly, trying to be careful about the types of images that are actually used in the online engagement and the type of symbols and signals and possible emotions that they actually give towards individuals who are looking at those resources and those websites. Just in terms of other ways of trying to reach out, there's also online campaigns that can be run at scale. We don't have time today to talk about how this can really be used in an effective way, but happy to discuss this during the question session later on. Finally, the recommendations that we came up with after looking at the rich results of this study, First, what this research has really highlighted is, how the potential of online technologies and also artificial intelligence tools, how that can really, really help during times of crisis in order for us to better understand what the needs are of women and girls, and how service providers and policymakers can reach them in a better way. Secondly, how can we better use such online tools to also reach more vulnerable populations? Third, I already spoke about this, but, finding different ways for service providers to increase their online engagement and better reaching people who are in need for these different issues. And there's very specific ways that one can do that. Then, also service providers, including government actors, how they should be implementing different steps in trying to increase their reach and their communication strategies online towards survivors. And then finally, how governments and internet providers can really work together to look at search engine behavior and how that can be used in a much better way to not just reach individuals, but also work together in partnership so that we can prevent such violence from happening in the future and also respond in a timely way with effective online tools to meet the needs of survivors across all these 8 countries and globally. So thank you very much for your time. I'm done with my presentation and happy to take any questions later on. Sorry, I just had the recommendations for migrants. For migrants, as I mentioned, mental health was extremely important issue that came up. So number 1, ensuring that essential quality service provision is available for everyone at this time, and this includes both male and female migrants. Secondly, to ensure that there's reliable information that's available on these different services, and this is for the others as well. This is something that we found among service providers. And finally, for female migrants in particular, being sure to establish and support women migrant workers networks, both in the countries of origin, during transit and countries of destination. This will be immensely important, especially for information sharing and for the different partnerships that I was talking about earlier. So again, thank you so much for your time. I think I used an extra minute, but again, looking forward to discussing all of this later on. Thank you very much.
Thank you so much, Pia. That was really fascinating. I think it's so interesting not only to see the results, but also to understand a little bit more from you about the methodology, which I know is very interesting for our participants today. So this study, I think, really demonstrates the value of using the big data analysis to understand trends related to violence against women. It really helps us to better understand how diverse groups of women experience the COVID-19 lockdowns and what their needs for support might be if they face violence. It's very distressing, actually, to learn that violence and online misogyny seem to have increased during the COVID-19 pandemic. It's a very worrying trend. But at the same time, it is good to see how much support there seems to have been for survivors online and how much discussion of the issues there seems to have been. So I think this is something that we can really think about how to build on in the future. I hope that these findings can inform all of our responses and the responses of our partners to the shadow pandemic of violence against women during COVID. Now, we will now move on to a moderated panel discussion with our guest speakers, Ms. Uma Shah, Ms. Shaili Hingarani, and Ms. Sumitra Visvanathan, as well as having Pia here as well to respond to some of the questions later. So, panelists, I would like to begin with a question for Uma Shah, if that's okay, Uma. So, Ms. Shah, the study suggests that during the COVID-19 pandemic, online violence against women and girls related searches increased, and this may signal an increase in the incidence of violence against women and girls. In the absence of official statistics, how do you think these findings can be used in your country? What do you think has to be done to better respond to violence against women during COVID-19 and similar crisis situations? Over to you, Uma.
Namaste and good morning from Nepal. I'd like to thank the organizer for giving this opportunity to Sathi to be part of this program. Sathi is a pioneering organization to address the contemporary issues of domestic violence in Nepal since 1992. It was taboo to talk about domestic violence publicly during those days. Now I shall come back to the answer. My answer to the first question is, it has been proven now and again that violence against women and girls increases during crisis, be it pandemic, natural calamities, or conflicts, etc. Women, and particularly the ones in the vulnerable groups, are to be extremely experiencing higher exposure to violence against women and girls. During the COVID-19 pandemic, social distancing, mobility restriction have posed challenges to collecting official statistics on the prevalence of violence against women and girls, as many face-to-face surveys have been interrupted due to fear of infection. Official statistics are very essential and important to map any kind or types of incidents to fulfill the requirements of the citizens of any country. Absence of official statistics should not hinder in addressing the issues of violence against women and girls, and continue providing support during the time of crisis too. Online survey and findings can be very important because it is an entry point to strengthen the services. Big data online searches and public posts was analyzed in Nepal to identify trends of violence-related researches as well as help-seeking behavior. Online searches is useful in providing proxy information regarding general traits. Existing literature of big data from online shows that physical violence in Nepal grew by 55%. Such queries include sexual assault, rape, verbal abuse, wife beating, and abusive relationships. There were about 463 number of violence against women related searches for 100,000 people in Nepal. During lockdown, internet users grew. Online platforms saw more online misgrooming, such as instances of trolling, using images without consent, or sexual harassment. 188% of tweets with the misogynistic language were found in the case of Nepal in the big data. In Nepal, big data online survey made possible to a certain extent to highlight the cases of sexual violence against Dalit women and girls, made national headlines and fueled Dalit Lives Matters movement. Big data on online survey shows that that help-seeking searches increases by 47% in Nepal, and users with online campaigns, advocacy for justice support groups, and other support misgrooming. There were 45% male and 55% 45% is female and 55% is male urban concentration. Now I will go to the online services that was used by Nepali people. Youth in Nepal use data to respond to COVID-19 in the midst of COVID-19 pandemic. When Nepal and most of the world was in an extended lockdown, the Facebook group Nepal Data Literacy Community grew active. The young data groups shared ideas, resources, and opportunities. When the pandemic hit, some members of the community saw an opportunity to collaborate and use data that would help inform people and visualize the information in a user-friendly manner. Access and use of quality and timely online data are an integral part for Nepal to achieve its development goals. It can help policymakers develop effective policies to mitigate the socio-economic impact of the crisis. With Tati's experience of working on and for the violence against women and girls for almost 30 years, data has been issues especially during crisis to validate our work. Online data system will definitely help us to explore new ideas, have cross-learning opportunities, lobby and sensitize, and help the government to bring out the official statistics. During COVID, Sati was able to reach out to survivors of violence through posts shared in the Facebook, through our own Facebook page, and 24/7 hotlines of the organization. Sati also conducted a rapid shelter assessment to find out the operation of shelters through online platform, and we have shared those findings to the UNFPA in Kathmandu. Now I move on to my second answer. My second answer is about women and young girls and children always are the victim of violence during crisis, be it COVID or the pandemics. Nepal being the patriarchal society, women and girls are treated as second-class citizens even during the crisis time. Here are some points that I'd like to share to better respond to violence against women and girls during moments of crisis. Prevention and management of the violence against women and girls should be included as an essential service in the response plan. Healthcare and frontline workers should be oriented and prepared to address violence against women and girls in the setting. The support shelter should be available and its access to women must be ensured. These services should be prioritized as essential service without disruption in its operation. And I would like to add that since shelter is just, SATI just initiated the formation of National Network of Women Shelter, we will be lobbying with the Nepal government to recognize shelter services as essential service, because we faced a very difficult times during the COVID period. Due to immobility, we could not bring the survivors to our shelters. So this we thought very important that we have to lobby to the government to recognize shelter services as very essential services. And another point is public awareness on various forms of violence, including child marriage, harmful traditional practices, and its effect and ways to seek help should be done through mass media mobilization, dissemination of digital platform for seeking help. Communities groups like mothers group, youth group should be oriented and mobilized during this period to check women and who are at the risk of violence and act as a support system to guide them accordingly. Helpline and toll-free services should be in operation 24/7 and be prompt in action. To reduce the violence, the security service like police should be prompt to register the reported cases and punish the perpetrators. Security forces should be sensitized and mobilized to check in the isolation, quarantine, and most vulnerable areas so that the violence do not occur in such premises. Healthcare services should be prompt and ambulance in standby to take the victims to the hospital and to other needed services by the victims. Strong pool of certified psychosocial counselor to address the emotional situation of the survivors of violence and help her or him to come out of the stress and trauma. Because during the COVID time, there were a lot of suicide cases at the same ratio of the violence also. Government and stakeholders should always be focused on handling the crisis instantly and not delay the process. With this, I come to the end of my answer. Thank you very much for this opportunity to allow me to speak. Thank you so much.
Thank you so much, Ms. Shah, and we really appreciated hearing from the experience of Sati in Nepal during this crisis period. And thank you so much for emphasizing both the usefulness of the big data, but also some of the very pressing service needs for clients facing during this time. We really appreciate that. Thank you.
Thank you so much.
Thank you very much. So now I'm going to turn to Ms. Hungarani, who is joining us from Singapore. And I'd like to ask you a little bit about the classification of the social media posts by the service providers, Ms. Hungarani. So as we saw in this analysis, we looked at them as high engaging providers who posted really regular content that their audience could interact with, including information on signs of abuse, services that the organization provides, and contact information for hotlines and shelters. And we also saw that some other providers tended to post a more low engaging content, as it was classified, looking more at what they do behind the scenes. So I just wanted to ask whether these findings can support you in designing online engagement strategies, and how would they contribute to increasing engagement online and helping to reach those who are in need of services? Over to you.
Thank you so much, Sarah, for that question. And thank you for a rich and insightful presentation, Pia, and the team at Quilt AI. And of course to UN Women and other sister organizations for convening this important forum. Aware Singapore is one of Singapore's oldest women's rights organizations. We use a combination of research, training programs, and services to advocate for a feminist, gender equal future. If I may, in my response, I would like to cover both social media posts by service providers as well as social media behaviors of allies, detractors, and victims and perpetrators. A lot of the existing research has focused on social media to track natural disasters, political opinions, and healthcare. not as much attention has been paid to women's rights issues such as domestic violence. But we know that victims of domestic violence have turned to social media platforms to express their feelings, to share their experiences in the form of posts, and they do this to seek social and emotional support. So far, it has been difficult to mine any actionable knowledge from large conversational data sets from social media due to high volume and high velocity. But Priya's presentation changes that. The question for me then is how we can use insights gleaned from Quilt AI's presentation to hone our strategies to do three things: to change attitudes, especially those who think the victim is to blame or that violence and abuse is a private matter. Second, to change behavior, make victims feel more confident to report abuse, empower individuals to play their part in tackling domestic violence. And finally, to mobilize public opinion to effect policy change. Several organizations I've met in the course of my work, and I'm talking about Singapore here, tend to dismiss social media discussions as mindless chatter, deliberately focusing attention on offline work because for them, public discussions online are not as important. However, in our experience, when there is limited public discussion of an issue, a condition of pluralistic ignorance exists. If no one is concerned, the issue seems unimportant and action unnecessary. And given inaction, individuals tend to shift awareness away from these issues to lessen their own feelings of danger, personal responsibility, and guilt. Although Priya's presentation defined low engaging content as content that does not reach too many people, which is of course absolutely crucial, I think we can just expand this definition to include content that doesn't necessarily and successfully engage with the current discourse on domestic violence. What do I mean by discourse here? I'm interested in the production of social knowledge and meaning through the way domestic violence is represented in social media posts or talked about. In my opinion, civil society organizations have to engage head on with the social practices of everyday life when it comes to domestic violence. And this includes how domestic violence is getting represented on social media in more traditional media platforms and framed. Now, based on social media content I've seen in Asia particularly, I think there are about 5 common pitfalls that civil society organizations are not able to successfully avoid. First, they often frame their domestic violence content at an individual level with very little societal context. It's not only the sheer magnitude, and we all know this, that places domestic violence at the societal level. Many of the contributing factors, such as gender power imbalance or victim blaming attitudes, are beyond the control of individuals. Yet social media content frequently fails to frame the issue in a wider societal context. Framing domestic violence as an individual issue taking place behind closed doors, of course, reinforces the belief that domestic violence is a private matter. Second, low engaging providers, and remember, I'm using my own definition for this, leave some of the most problematic public attitudes contributing to social silence around domestic violence and the underreporting of domestic violence, such as victim blaming and normalization of abuse, largely unaddressed. Third, we know that the number of domestic violence cases reported to authorities is notoriously low. This is not helped by the fact that a lot of social media content that we frequently come across give out mixed messages and include vague calls to action, which obviously don't prompt the desired outcome of more sort of people speaking up against and reporting domestic violence. Call to action often lacks specific instructions. Many campaign texts that I've seen actually do not go beyond telling the public to speak up. Fourth, very much like the issue itself, victims of domestic violence in these social media posts are often represented in isolation, and the responsibility to act and stop the abuse is often placed on them. effectively excluding perpetrators from this conversation. Victims are asked to speak up without providing tangible guidance. When talking about abuse, I think it's important for our social media messaging to offer emotional support and information rather than pressuring women to potentially put themselves at risk by demanding that they contact local authorities, such as the police. Frequently, we also don't provide any positive visualization as to how life after the abuse and living in safety from the perpetrator could look like. And consequently, instead of encouraging victims and building their confidence, we end up painting a bleak picture of isolation and fear. In addition to addressing these points, there are 5 other things that I think we should bear in mind while trying to create high engaging content. I think first, we frequently skip over formative research that helps us understand the state of the public discourse on domestic violence better. So to give you an example, in the context of Singapore, a 2019 survey on public attitudes to domestic violence told us that 84% of Singaporeans consider that hitting a spouse and leaving a physical wound constitutes domestic abuse. But this percentage drops to 75% if one hits a spouse but does not leave a physical wound. The percentage drops further to 56% for psychological abuse and 48% for exerting control over finances. Now, we've used at Aware Singapore these insights to create content that was focused on educating the public on coercive control, on financial and emotional abuse. We've also frequently shared resources from other jurisdictions. For example, there's a fabulous video of a survivor from Wales talking about and really breaking down what psychological control looks like in the context of a romantic relationship. Second, and this may seem somewhat counterintuitive because we're all trying to build more and more online engagement, but I think it's essential that civil society organizations don't try to reach everyone through every single post, every single social media post. Now, I understand that most organizations have a broad range of audiences, right, that we've spent a lot of time building over time. But when developing specific campaigns, I think it's absolutely essential to narrow down our audiences and identify subgroups to whom you can tailor your messages and more effectively engage. In the case of Aware, during the lockdown period, referred to as circuit breaker in Singapore, when we knew that mobility, access to social services was restricted, we created a series of Instagram-specific graphics on what to do when violence is inevitable to avoid brain damage, long-term medical damage. Usually when I talk to people about targeting campaigns at a segmented sort of population, they ask me about inclusion. So let's remember that targeting a particular population subgroup doesn't mean that your language and your visuals do not need to be inclusive of historically marginalized groups. During lockdown, for instance, Aware also issued a series of campaign messages that were targeted at LGBTQ communities, domestic workers, migrant spouses, groups whose specific vulnerabilities are not addressed in many domestic violence campaigns. Third, I think it's important to decide before you launch a campaign, before you decide on a social media engagement strategy, what level of change you're aiming for. We know that social media tools can be used to communicate on many different levels. You can use them to expose, to engage, or generate action. I want to share 2 quick examples here from work that we have done at Aware. As we received real-time information from our women's helpline in the run-up to the lockdown in Singapore, and of course we had people reaching out to us on social media as well, we quickly realized that in order to engage with abuse victim survivors, we need to align our social media offerings with the evolving needs of abuse victims and survivors. We worked with social media platforms to create solutions that were targeted at their users, inspired somewhat by Snapchat's Here For You campaign. We worked with Twitter to create an in-app model such that when a user searches, for example, for abuse, They'll be connected to a range of resources to assist with various concerns and circumstances. Similarly, after we noticed that there was an uptick in the number of calls we were receiving on behalf of victim survivors, we decided to focus on communicating with other people like them to generate action. We created a short 4-minute video on how to respond when your friend is experiencing domestic violence. In this video, we suggested 3 steps that you, as a friend, colleague, can take that will make a big difference. These steps were empathy, empowerment, and resources. Easy to remember. Now, as civil society organizations, we also need to remember that we need to create platform-specific content, and we need to align ourselves with the evolving needs of abuse and victim survivors, the information that we have on how people are using different platforms. And I think failure to do so is likely to lead to poor results. For example, if your channel mix is heavily focused on Instagram, your content mix obviously should be informed by Instagram's strengths as well. Finally, while technology can and certainly is a force for good, we as civil society organizations also need to acknowledge and address the ways in which social media has changed the face of domestic violence by creating more opportunities and private channels for abuse to take place. So as we reach out to abuse victims and survivors on social media, we must keep their security and safety in mind too. We need to extend resources to them that do not leave a digital footprint, for instance. We need to extend resources that allow them to seek support without compromising their privacy. I'll stop here. Thank you.
Thank you so much. And I really appreciated you really relating to very practical work, but also I think, really reminding us of all of the different implications that the words we use can have and the ways that we communicate can have, sometimes even, in unintended ways. Thank you very much. So I'm going to turn now to Sumitra Viswanathan, who is joining us from Women's Aid in Malaysia. And my question to you, Sumitra, is really focusing on migrant populations, which I know has also been a topic of some of the questions in our chat as well. So service organizations targeting migrant populations tended in this study to have lower online engagement. But the data shows that migrants themselves did create online spaces for dialogue and mutual support. Can you share some ideas on how services can be offered to migrants by leveraging those kind of platforms? Thank you so much.
Great, thanks so much, Sarah. So just to say that I think just to start off with saying that this piece of research that's been done and also hearing from Pia has been so amazing. We always talk about wanting to do data-driven advocacy, data-driven programming, but a lot of the work that WAO does and a lot of the evidence that we put out there is what we get from our own work, from the women that we actually do support. So sometimes what happens is that we get a conflict. So let me give you an example. During the MCO, when the lockdown first started, WAO saw a 3-time spike, so a 3-fold spike in the number of cases and women that were calling us, number of cases that we were handling. And when we put that out to the government, we immediately got pushback from law enforcement to say that actually that's not been our experience. So it sometimes comes up to be a conflict between what the civil society group is saying about our own evidence and what government agencies may be saying. So this kind of big data is so important because, it's AI based, it's about general sentiment, it's about what people are talking about, and it becomes, I think in a way has that added credibility when it comes to driving it. So just to go back and talk about, when the lockdown first started. So we kind of saw it coming from a distance. We could tell that something was going to happen and potentially that we would all need to go into lockdown and work from home. So we have a very front-facing service, Women's Aid Organization, since 1982. We have been at the forefront of providing support services for women survivors of violence. We run a whole range of services, including social work, shelters, counseling, and then we also take all of that knowledge that we gain from providing direct services and we channel it towards our advocacy work, public awareness, and also building capacity amongst government frontliners. So, we could see that coming, and we shifted. We did the contingency planning, we did all the risk management, we bought all the tools that we needed to, we bolstered our capacity, and then we switched to online. So very, very soon after lockdown, we started providing services online. We saw an initial drop, and then it just like zoomed, went all the way up. So during that time, you know, a lot of our thinking was about access, and not just about access to service, it was also about access to information. And then we started to be very, very aware of the gaps that we had you know, ongoing over a period of time, in terms of relevance, in terms of reach, and so forth. So let's talk about demographics. We serve all women and girls, regardless of their status, their nationality, whether they're documented, undocumented, etc. But we've always known that our reach is limited when it comes to migrant worker communities, and also when it comes to women living in remote areas. It's something that we thought about, that we tried to find solutions to. So one thing that we did early on is a lot of advocacy with the Central Organizing Committee. So there is a government security agency that was the coordinating body during MCO, and we did a lot of advocacy with them, and they put out the WAO hotline number through SMS. And SMS, reaching communities through SMS is actually a lot more powerful than reaching communities through WhatsApp or so forth, because it goes through your mobile service provider. So we did that, and then realizing that that reach was being facilitated, because then we started to get a lot more calls on our hotline from sectors of women who normally would not reach out to us or would not necessarily know about us. Let me give you an example. Like, for instance, we had one woman, she was a migrant worker, domestic worker, and she was in a situation of where she was tolerating living under abuse. She reached out to us at the same time as her neighbor reached out to us. And then we managed to, and this was completely online, we managed to coordinate her being smuggled out of that gated community by the neighbor to the police station and then to our shelter. So that's just one example of how important that online engagement is. How can we further strengthen it? How can we do more? So we right now are in a project with UN Women and through the Safe and Fair program, together with also with ILO. And as part of that program, we are actually actively looking at ways to enhance the WAO hotline so that we are able to reach, and we are able to provide access, and we are able to provide information to more women, to sectors of the community who normally would have found so many barriers. So this is our hotline. So what we've done is we have upgraded to a CRM platform where there are multi-channels. So women can reach out to us through Facebook Messenger, they can reach out to us through Instagram, they can SMS, they can WhatsApp, and so forth. and we would be able to receive their queries, and we would be able to ensure that we not just provide the follow-up service, but that we are also able to track and monitor that follow-up, as well that we would be able to document the experience and then turn that into really valuable data and evidence for moving forward. Policy change, public information, etc. So something that I want to say also about women migrant workers in Malaysia is that it's not just about, it's not only about misogyny. It's not only about not being protected, undocumented women not being able to access government services and etc. There's also xenophobia. So xenophobia is one of the biggest barriers as well that all migrants face, but compounded obviously for women migrant workers. There is so much fear about reaching out to a Malaysian, to reaching out, fear around reaching out to a someone who's not necessarily within their community. So something else that we are trying to do is to not just reach out to existing networks, but also to find ways to enrich those networks through our engagement. So we have a very active and vibrant capacity building team. And our capacity building team, they do something that we call Community Selamat. It's a program, it's called Safe Community Program. And they go out into refugee communities, they go out into migrant women communities, and they do two things. So the first thing that they do is, they bring the women together in a safe space and have a conversation and listen and exchange and have a conversation around, the issues that are most important to them, to try and understand what is the situation when it comes to their protection, their rights as women, their rights as workers with refugees, then also their rights as refugees. So we have that conversation, and then we exchange and we try to raise awareness on rights, on that gender lens, bringing that gender lens to understand better, what they are indeed entitled to under the law, what they are entitled to as human beings, as women, and also where they can go for support and access to services. So we have that conversation with them. The other thing that the next step then is to identify women within those groups who are interested in being the influencers. So that's what we call Team Tina. And Team Tina is a group of women, not just refugees, not just migrant women, not just Malaysian women, but it's a group of women who are trained by WAO to be the eyes and ears within the community, to do that PFA, that psychological first aid, to give that initial information, to be that one-stop info center within the community that will be able to give out information and also, very importantly, link them to the most appropriate service that would be able to support the woman through the experience. So one of the biggest challenges, obviously, is that migrant women who lack documentation, official documentation in Malaysia, are extremely vulnerable to legal repercussions from the immigration legal framework. So there are many instances that we know of where refugee women and migrant women who face GBV, who are survivors of domestic violence, etc., have a great deal of fear around approaching the police, approaching law enforcement, because as well they fear the potential repercussion from immigration laws. So that is, yeah.
Thank you so much, Sumitra. May I ask you to wrap up now? Sorry, because we just want to take a few questions from our audience as well. Thank you. Okay. Did you want to add more, Sumitra? Are you?
No, I'm fine. I'm good.
Okay, thank you so much, Sumitra, and thank you so much. I really appreciated you bringing everything back to the experience that women are having that you're working with. That was really, really valuable and very inspiring to hear about the work WAO has been doing. Now, we do have time for a couple of quick questions from the audience. I appreciate that there's been a lot of interest and some of the questions have been answered already in the Q&A box, but I'd like to direct a question first actually to Pia. And the question is, what are the cultural anomalies between the countries in the research? In other words, why did we see abuse language fall in Indonesia, for example, versus rising so dramatically in a place like Singapore? Over to you, Pia.
Sure, thanks a lot for that very interesting question. So a lot of it has to do with external factors that we can't always control for. So this could be the severity of the lockdown in the country. This could be because of mobility restrictions. It could be what's popular in the news cycle at the moment, or whether there's specific high profile cases that have actually happened, which is going to drive up search traffic. So that's sort of one reason. Another reason, which is Singapore specific, is that is also the country where we found a lot of the high engaging service providers who are very sort of smart and strategic about the way that searches are used and actually linked up to other service providers. So that could be another reason for the specific Singapore context. But this is just generally telling you that it's mostly external factors that we cannot control for.
I'm sorry. Thank you so much. Thank you very much indeed, Pia. Now, I'm just going to see if we can maybe just answer one more question before we have to wind up. So this question is directed actually to Shaylee. Shaylee, technology needs to reach women and marginalized communities so they have access to report their distress. Can you give us some ideas about how we can do that in a feminist way? Shaylee, over to you.
Thank you. I can actually not turn my camera on because it's been disabled by the host, but I'll go ahead and respond to that question. I think the question is really about digital safety. And at the core of it is the fact that we are as secure as the least secure person in our networks. Taking digital safety seriously is a responsibility that I think each activist should take to heart. It has to become central to our activism. It's a mantra that we must chant repeatedly. The first step, of course, is being personally safe. This means that your community should not be compromised through you. If you're part of an organization or network, I think it's really important that you discuss issues of digital safety, create a policy for all members to adhere to. The second step that I think is equally important is that you need to build knowledge around digital safety. You have to know how the internet works. I think this will enable us to see where the potential threats are coming from. You also have to keep your computer healthy. You have to protect the data on your computer. You have to make sure that you're searching the internet securely. And you're regularly sort of clearing your browsing history. I know I don't have a lot of time, so I'm going to stop here, but I'm happy to carry this conversation on offline.
Thank you so much for that, Shaylee. And I'm sorry that we are coming to the end now, so we don't have time to answer more questions online. But at the same time, I know that some of the questions have already been answered in the Q&A, and I know that our panelists are very kindly responding to a couple of others for you as well. It's been really wonderful to have so much interest, so thank you so much, everyone. I'd like to thank all of you for contributing to the discussion. As we've heard today, there's a lot that we need to do. There's a lot that we've learned from this study, but there's a lot that we need to do. We're really pleased that the study has helped to shed some light on how we can better tailor information to make services and information more accessible, to better use technology to address inequalities and access to support, particularly for the most vulnerable groups, such as migrant women, women with limited access to the internet, and those in rural areas. So I really appreciate all of your interest and all of the inspiration that we had hearing from our excellent panelists. Thank you so much for making the connection all the time between the data and the realities of women's lives and the realities of what we need to do. I just want to remind everyone that this publication will be available on our website after the event. Plus, we have also shared the link already in the chat box if you would like to go to it right now. In closing, I would just like to thank all of our speakers, Mohammed, Bjorn, Pia, Shaylee, Uma and Sumitra for your contributions today. To thank the EU for continued commitments and support under the Spotlight programme, and to thank all of our partners for working together on this study. Thank you very much for all of you as participants for joining the launch. We're so pleased to see your interest in this work, and we look forward to continuing opportunities to engage with you. Thank you so much, everyone. And this is just a reminder as well for the UN Women staff to stay online for the follow-up discussion. Thank you so much, everyone, and goodbye.